I'm Dr. William Carter, and in my 25 years as a board-certified urologist caring for men over 50, I've heard one question asked more often in the privacy of the exam room than almost any other doc. Is it okay that I still masturbate? Am I hurting my prostate? What about my testosterone? These men, successful professionals, grandfathers, widowers, divorced guys starting over, whisper this question as though admitting something shameful, and I want to tell you right now that it's one of the most normal, healthy questions a man can ask about his body. If you're 50, 60, 70 or beyond, and you're wondering whether frequent or daily masturbation helps or harms your health, your prostate, your hormones, your erections, your relationships, your sleep, you're in the right place. This video is going to give you real science, real-life application, and clear guidance on how to approach this part of your sexual health with confidence and clarity. Before we dive in, hit subscribe, share this with a 50-plus friend who needs real answers, and drop your number one question: prostate, hormones, sleep, or performance in the comments. I read everything and answer the top questions in upcoming videos. Now, let's set the record straight. Masturbation is a physiological function, a normal expression of human sexuality that continues across the lifespan. We're not here to discuss morality or personal values, those are yours to define, but rather to look at what the science tells us about health impact in men over 50. To understand that impact, we need to start with some basic physiology. When you become aroused, your brain releases dopamine, the neurotransmitter that drives motivation and pleasure, along with oxytocin, which fosters connection and calm. Your nervous system shifts into parasympathetic dominance, the rest and digest mode that allows blood vessels in the penis to dilate through the release of nitric oxide. This nitric oxide-mediated vasodilatation causes the cavernous, once smooth muscle in the erectile chambers to relax, allowing blood to flow in and fill the spaces. As these chambers expand, they compress the veins that normally drain blood away, creating what we call the veno-occlusive mechanism, essentially trapping blood in the penis to maintain rigidity. Orgasm involves rhythmic contractions of the pelvic floor muscles, the prostate, the seminal vesicles, and the urethra, followed by a release of prolactin and more oxytocin, which together produce that sense of relaxation and sometimes drowsiness. This entire cascade is a coordinated symphony of neurological, vascular, and muscular events, and understanding it helps us appreciate why regular sexual activity, including masturbation, can support men's health as we age. Let me start with what might surprise you. There are genuine, evidence-backed health benefits to maintaining regular ejaculation as you get older, and I'm going to walk you through them in a way that makes sense for your body and your life. The first benefit has to do with something we call use it or lose it mechanics in the erectile tissue. Your penis is not just skin and sensation, it's a vascular organ filled with smooth muscle and Ndwalhe cells that line the blood vessels. These tissues need regular oxygenation and stretching to stay healthy. When you have erections, whether from arousal, masturbation, or those spontaneous nighttime erections, you're flooding the cavernous tissue with oxygen-rich blood, which helps maintain the elasticity of the smooth muscle and prevents fibrosis, the scarring and stiffening that can occur with prolonged disuse. I've had patients in their 60s who stopped all sexual activity after a divorce or the loss of a spouse, and when they tried to resume a year or two later, they found that their erections were weaker, shorter, or more difficult to achieve. That's not just psychological, it's tissue remodeling. Regular arousal and ejaculation, whether alone or with a partner, help preserve erectile function by keeping those tissues flexible and responsive. The second benefit involves the prostate itself, and this is where a lot of men's anxiety lives. You've probably heard conflicting information about whether ejaculation is good or bad for the prostate, so let me clarify what we actually know. The prostate produces a significant portion of the seminal fluid, and when you ejaculate, you're essentially flushing the gland, clearing out old secretions, cellular debris, and any potentially inflammatory compounds that have accumulated. There's a well-known cohort study from Harvard that followed nearly 30,000 men over 18 years and found an association, not causation, but an association between higher ejaculation frequency and lower risk of prostate cancer. Men who reported ejaculating 21 or more times per month had a roughly 20% lower risk compared to those who ejaculated 4 to 7 times per month. Now, I want to be careful here. This doesn't prove that masturbation prevents prostate cancer, and it doesn't mean you should force yourself to hit a quota. What it suggests is that regular ejaculation might support prostate health through that flushing mechanism, possibly by reducing the buildup of carcinogenic metabolites or by influencing hormonal signaling in the gland. It's a hypothesis supported by observational data, and while we can't make sweeping claims, it's one piece of evidence that regular sexual activity isn't harmful and may be protective. The third benefit ties into pelvic floor health, which is something most men don't think about until they start having issues with urinary leakage, urgency, or weak stream. Your pelvic floor is a hammock of muscles that supports the bladder, rectum, and prostate. And it plays a key role in urinary control and sexual function. During orgasm, these muscles contract rhythmically and forcefully, and that contraction is essentially a workout for the pelvic floor. Over time, regular engagement of these muscles can help maintain their tone, coordination, and responsiveness, which translates to better continence and control. I've had patients who developed mild stress incontinence, leaking a little when they cough or lift something heavy, and when we integrated pelvic floor exercises along with mindful sexual activity, they saw noticeable improvement. Masturbation, when done with awareness of those contractions and not just rushing to completion, becomes an opportunity to train those muscles in a functional, pleasurable context. Now let's talk about stress and mood, because this is where many men over 50 notice the most immediate benefits. Chronic stress elevates cortisol, the hormone that keeps you in fight or flight mode, raises blood pressure, disrupts sleep, and contributes to weight gain and insulin resistance. Orgasm triggers a cascade of calming neurochemicals. Dopamine gives you that rush of pleasure and reward. Oxytocin fosters a sense of connection and relaxation, and the parasympathetic nervous system takes over to bring your heart rate and blood pressure down. For many of my patients, particularly those dealing with work stress, financial worries, or the emotional toll of aging and loss, masturbation becomes a brief but powerful reset button. One man I remember, a 62-year-old executive dealing with high blood pressure and anxiety, told me that his morning routine of meditation, light exercise, and yes, occasional masturbation helped him start the day feeling centered and less reactive. He wasn't using it to escape or numb out, he was using it as part of a broader self-care practice that included sleep, nutrition, and stress management. That's the kind of integration we want to see. The fifth benefit is sleep, and this is a big one for men over 50 who struggle with insomnia or frequent nighttime awakenings. After orgasm, your body releases prolactin, which has a sedative effect, along with more oxytocin and a drop in cortisol. This combination can promote deeper, more restful sleep, especially if you're dealing with the kind of ruminative anxiety that keeps you awake at 2 in the morning. However, and this is important, timing matters. For some men, masturbating right before bed works beautifully. For others, especially those dealing with benign prostatic hyperplasia and nocturia, stimulating the prostate and bladder right before sleep can actually trigger more frequent urination during the night. We'll come back to that when we talk about practical adjustments, but the key point is that the relaxation and hormonal shift from orgasm can be a powerful sleep aid when timed correctly. The sixth benefit is body awareness and early detection. When you're engaging with your body in this way, you have an opportunity to notice changes, lumps, plaques, lesions, asymmetry that might otherwise go undetected. I've had patients discover Paris plaques, firm areas of scar tissue in the penis that can cause curvature and pain during self-exploration. I've had others notice testicular masses or skin changes that prompted early evaluation, and in some cases, early treatment. This isn't about being paranoid or turning every intimate moment into a medical exam, but rather about cultivating a relationship with your body where you pay attention and take concerns seriously. For men over 50, who are at higher risk for conditions like testicular cancer, penile cancer, and sexually transmitted infections if they're dating, this kind of self-awareness is genuinely valuable. The seventh benefit involves libido maintenance and the preservation of erotic circuitry in the brain. Desire and arousal are use it or lose it functions in the nervous system. The neural pathways that process sexual stimuli, generate arousal, and coordinate the physiological response need regular activation to stay robust. If you stop engaging with sexual thoughts, fantasies, and sensations for long periods, whether because of depression, grief, medication side effects, or just life getting in the way, those pathways can become less responsive. I've worked with widowed men in their 70s who stopped all sexual activity after their wives passed away. And when they eventually met someone new and wanted to resume intimacy, they found that their desire and arousal felt distant or muted. Gentle, regular masturbation, even in the absence of a partner, can help keep that circuitry alive, making it easier to reconnect with your sexuality when you're ready. The eighth benefit is about safety and harm reduction. If you're widowed, divorced, or single and not currently in a relationship, masturbation provides a safe sexual outlet that doesn't carry the risks of sexually transmitted infections or the emotional complications of casual encounters. For men over 50 who are re-entering the dating world, this can be particularly important. You might not be ready for a new relationship, Or you might be navigating health concerns like erectile dysfunction or body image issues that make dating feel daunting. Masturbation allows you to maintain sexual satisfaction and connection with your own body while you figure out what you want and need in terms of partnership. It's a bridge, not a replacement for intimacy, but it's a healthy, low-risk bridge. The ninth benefit relates to medical management of conditions like benign prostatic hyperplasia and erectile dysfunction. When you're dealing with FNS, you might be on medications like alpha blockers or 5-alpha reductase inhibitors, and your urinary symptoms might make partnered sex less frequent or appealing. Similarly, if you're managing head with medications, lifestyle changes, or devices, you might be in a phase where you're adjusting treatment and figuring out what works. Masturbation in these contexts becomes a way to stay sexually active, test your response to treatments, and maintain a sense of agency and normalcy. It's also a space where you can experiment with pacing, pressure, and technique without the performance anxiety that sometimes comes with partnered sex. The 10th benefit is emotional well-being and dignity. For many men over 50, especially those raised in eras where sexuality was surrounded by shame, silence, and moral judgment, reclaiming masturbation as a normal, healthy part of life can be profoundly liberating. It's an act of self-compassion to say, I have needs, I have desires, and I'm going to meet them in a way that's mindful, respectful, and aligned with my values. It's also an acknowledgement that sexuality doesn't end at 50 or 60 or 70, it evolves, and that evolution deserves space and celebration. When masturbation is framed not as a guilty secret but as mindful self-care, it can reduce shame, improve body image, and foster a healthier relationship with aging and desire. Now, with all those benefits laid out, I want to shift gears and talk about the risks and precautions, because balance is everything in medicine. Just because something can be beneficial doesn't mean more is always better. And there are real pitfalls that men over 50 need to be aware of when it comes to frequency, technique, and context. The first risk is compulsion and overuse. If you find yourself masturbating multiple times a day, to the point where it interferes with work, relationships, sleep, or daily functioning, that's a red flag. Compulsive sexual behavior can be a response to stress, anxiety, boredom, or underlying depression, and it can create a cycle where you're chasing the dopamine hit rather than experiencing genuine arousal and satisfaction. Physically, overuse can lead to pelvic floor tension. Those muscles become chronically tight from repeated contraction and friction, injuries to the skin of the penis. I've treated men with painful microdors, monas, and inflammation because they were masturbating multiple times a day with insufficient lubrication or breaks for healing. If you're noticing that your behavior feels out of control, or if your body is showing signs of overuse, it's time to pull back and, if needed, talk to a healthcare provider or therapist who specializes in sexual health. The second risk involves skin integrity and hygiene. As you age, your skin becomes thinner and more fragile, and the skin of the penis is particularly delicate. If you're using a dry grip, not enough lubrication, or rough techniques, you can create microdors that increase your risk of infection and discomfort. Additionally, poor hygiene, not washing your hands before and after, not cleaning the penis and surrounding area, or using unclean objects or devices can introduce bacteria and lead to infections like urinary tract infections, balanitis, or even prostatitis. I've had patients come in with painful, red, swollen glands or foreskin, and when we dig into the history, it often comes down to aggressive technique and inadequate cleaning. The fix is straightforward: use a good water-based or silicone lubricant, be gentle, and maintain basic hygiene. This isn't rocket science, but it matters. The third risk is desensitization, often called death grip syndrome. If you're using a very tight grip, very fast stroking, or very specific, intense stimulation during masturbation, you can train your nervous system to respond only to that level of intensity. The problem arises when you're with a partner, because the sensations of vaginal or oral sex are typically softer, slower, and more variable than what you've conditioned yourself to need. This mismatch can make it difficult to reach orgasm during partnered sex, which creates frustration, performance anxiety, and sometimes avoidance of intimacy altogether. I've worked with men in their 50s and 60s who could only climax with a very specific technique they'd been using for decades, and it took deliberate retraining, looser grip, varied strokes, slower pace, more focus on sensation rather than outcome, to broaden their responsiveness. If this sounds familiar, the solution is to diversify your technique and give yourself permission to explore different speeds, pressures, and rhythms. The fourth risk is related to pornography and the impact of visual stimuli on your arousal pathways. I'm not here to moralize about porn, but I do need to tell you what I see in clinical practice. Many men over 50 grew up without internet pornography, and when they discover it later in life, they can become desensitized to real-world sexual stimuli because the intensity, novelty, and hyperstimulation of porn far exceed what happens in partnered sex. Your brain releases dopamine in response to novelty and reward, and if you're clicking through endless videos to find the perfect scene, you're training your brain to need that level of stimulation to become aroused. I've had patients tell me they can't get excited about sex with their wives anymore, and when we explore their patterns, they're spending hours each week consuming increasingly specific or extreme pornography. The fix isn't necessarily to quit porn entirely, though for some men that's helpful, but rather to become mindful about your use. Consider audio-first erotica, written stories, or simple fantasy without screens. Give your brain a chance to respond to subtler cues, and see if that shifts your desire and arousal in partnered contexts. The fifth risk I need to address is prostatitis or cedar flares in some sensitive men. While regular ejaculation is generally beneficial for the prostate, there are situations where too frequent stimulation can irritate an already inflamed or congested gland. If you have chronic prostatitis, that dull, icky pain in the pelvis, perineum, or lower back, overdoing it can sometimes worsen symptoms. Similarly, if you have significant cedar with a very enlarged prostate, aggressive or very frequent masturbation might trigger more urgency, frequency, or discomfort. The key here is to listen to your body. If you notice burning with urination, increased pelvic pain, fever, or blood in your semen after masturbating, stop and contact your doctor. You may need antibiotics, anti-inflammatories, or adjustments to your cedar medications. Hydration is critical. Drink plenty of water, avoid excessive caffeine and alcohol, and give your prostate time to rest if you're flaring. The sixth risk has to do with sleep disruption when masturbation is combined with late-night screen time. I mentioned earlier that orgasm can promote sleep, but that benefit can be completely negated if you're masturbating at midnight while scrolling through bright screens, reading news, or watching stimulating content. Blue light from screens suppresses melatonin, the hormone that signals your brain it's time to sleep. And if you're engaging with emotionally or intellectually activating material, you're keeping your mind in an alert state rather than winding down. I've had patients tell me they masturbate to help them sleep, but then they spend another hour on their phones and wonder why they're still wired at 2 in the morning. If you're going to use masturbation as a sleep aid, do it without screens, in dim light, with a focus on sensation and relaxation rather than visual stimulation. Better yet, try it earlier in the evening, so you have time to wind down naturally before bed. The seventh risk involves guilt, shame, or conflict with personal values or relationship dynamics. Some men carry deep-seated beliefs from religious upbringing, cultural messages, or family attitudes that masturbation is sinful, shameful, or a sign of weakness. If that's your background, engaging in masturbation, even if you logically know it's normal, can trigger guilt and self-criticism that undermine the potential benefits. Similarly, if you're in a relationship and your partner feels threatened, hurt, or rejected by your masturbation, that conflict can create distance and resentment. These are not medical issues in the traditional sense, but they profoundly affect your emotional and relational health. My advice is to be honest with yourself about your values and, where appropriate, to communicate openly with your partner. Masturbation doesn't have to be a secret, and for many couples, acknowledging it as a normal part of each person's sexuality can reduce tension and even enhance intimacy. If you're struggling with guilt that feels paralyzing, consider talking to a therapist or counselor who can help you explore where those feelings come from and whether they still serve you. The eighth risk area involves comorbidities, underlying health conditions that require adaptations to your sexual practices. If you have uncontrolled diabetes, you might have neuropathy that reduces sensation or makes it harder to achieve orgasm, and forcing the issue with aggressive technique can lead to injury without you realizing it. If you have Perry's disease, with plaques and curvature, certain positions or angles during masturbation can cause pain or worsen the deformity. If you're on blood thinners like warfarin or direct oral anticoagulants, you're at higher risk for bleeding from even minor trauma. So you need to be extra gentle and avoid any rough handling. If you have cardiovascular disease, the physical exertion and heart rate increase during orgasm are generally safe. But if you're experiencing chest pain, severe shortness of breath, or palpitations, stop and seek medical evaluation. The point is that your technique and frequency need to take your whole medical picture into account. And when in doubt, ask your doctor whether there are precautions specific to your situation. The ninth risk is device misuse, specifically vacuum erection devices, constriction rings, or other aids designed to enhance or prolong erections. These devices can be helpful when used correctly, but they come with real risks if misused. Vacuum pumps should be used at low pressure for no more than 20 to 30 minutes at a time. And constriction rings should never be left on for more than 30 minutes, because prolonged restriction of blood flow can cause ischemia, tissue damage, and even permanent injury. I've treated men who left rings on too long and developed numbness, coldness, or color changes in the penis. Those are emergencies. If you're using devices, read the instructions carefully, follow time limits religiously, and if you experience severe pain, numbness, persistent erection beyond what's normal, or any color change toward blue or purple, remove the device immediately and seek medical care. These tools can be valuable, but they require respect and caution. The 10th and most critical risk category is knowing when to stop and seek immediate medical attention. There are certain warning signs that should never be ignored. If you experience bleeding, whether in your semen, urine, or from the penis itself, that's a signal to stop and call your doctor. If you have severe pain during or after ejaculation, particularly if it's accompanied by fever, chills, or difficulty urinating, you could have an infection like acute prostatitis that needs urgent antibiotics. If you develop a sudden penile deformity, a hard lump, or significant curvature that wasn't there before, you need evaluation for conditions like Perry's disease or even penile fracture, which can occur if the erect penis is bent forcefully. If you have numbness or loss of sensation that persists beyond a few minutes, that could indicate nerve compression or vascular compromise. And if you have an erection that lasts more than 4 hours called priapism, that's a medical emergency. Prolonged erection without ejaculation can cause permanent damage to the erectile tissue due to lack of oxygen, and you need to get to an emergency room for treatment. These situations are rare, but they're serious, and you need to know the red flags. Now that we've covered the benefits and the risks, let's talk about how to actually practice masturbation in a way that supports your health rather than undermining it. The first question most men ask is about frequency, and the answer is that there's no one-size-fits-all number. For some men over 50, 2 to 3 times per week feels comfortable and satisfying. For others, it's once a day or even twice a day, and for others it's once a week or less. The key is that it should feel like a natural expression of desire, rather than a compulsion or a chore. If you're doing it because you're bored, anxious, or trying to avoid something, that's a clue to examine your motivations. If you're doing it because you feel genuinely aroused and you want that connection with your body, that's healthy. A reasonable guideline for most men over 50 is somewhere in the range of 2 to 7 times per week, adjusted based on your energy, your relationship status, your work and stress load, and how your body responds. Pay attention to whether you feel good afterward, relaxed, satisfied, energized, or whether you feel depleted, guilty, or physically uncomfortable. Let that feedback guide your choices. Technique matters just as much as frequency. Start with mindful arousal. Give yourself time to relax, breathe, and let desire build, rather than rushing straight to physical stimulation. Use lubrication generously. A good water-based or silicone lubricant reduces friction and makes the experience more comfortable and pleasurable. Avoid the death grip tendency. Experiment with a looser grip, varied strokes, different speeds, and even pausing to let arousal build and ebb. This trains your nervous system to respond to a broader range of sensations, which will serve you well in partnered sex. Pay attention to your pelvic floor during the experience. As you approach orgasm, you'll feel those muscles start to contract, and you can experiment with consciously relaxing them in between contractions rather than holding tension throughout. Think of it as a rhythm contract. Relax, contract, relax. This not only enhances pleasure but also keeps those muscles flexible and responsive. After orgasm, give yourself a few minutes of aftercare. Hydrate, stretch gently, maybe take a brief walk. If you're doing this during the day, treat it as a complete experience rather than just the mechanical act of reaching climax. Let's talk specifically about how this fits into managing prostate and FNCD symptoms, because this is where a lot of men over 50 need practical guidance. If you have FNCD, you're probably dealing with urgency, frequency, weak stream, or nocturia, getting up multiple times at night to urinate. These symptoms are driven by prostate enlargement, bladder irritation, and sometimes pelvic floor tension. Masturbation and ejaculation can help by reducing prostate congestion, but timing and hydration are key. If you're having issues with nocturia, don't masturbate right before bed, because stimulating the prostate and bladder can trigger more urgency during the night. Instead, try mid-afternoon or early evening, and limit your fluid intake in the 2 to 3 hours before sleep. Moderate your caffeine and alcohol throughout the day. Because both are bladder irritants, a light walk after dinner can help reduce pelvic congestion without overstimulating the bladder. And if you're on medications like tamoxifen or finasteride, be aware that they can affect ejaculation. You might have retrograde ejaculation, where semen goes into the bladder instead of out through the urethra. Or you might notice reduced volume. These are expected side effects and not harmful, but it's good to know so you're not alarmed. Now let's address the elephant in the room: erectile dysfunction, mood, and testosterone. Many men over 50 worry that frequent masturbation is draining their testosterone and causing head. And I need to be very clear about this: moderate masturbation does not lower your testosterone in any clinically meaningful way. Testosterone levels fluctuate throughout the day and in response to sleep, stress, diet, and exercise, and while there might be a brief spike or dip around orgasm, it doesn't accumulate into a deficit. What does affect testosterone is chronic sleep deprivation, obesity, insulin resistance from poor diet and sedentary lifestyle, chronic stress, and certain medications. If you're experiencing symptoms of low testosterone, persistent fatigue, loss of muscle mass, depression, very low libido, difficulty with erections, you need a proper evaluation with your doctor, including symptom assessment and laboratory testing done in the morning when levels are highest. Don't assume that cutting out masturbation will fix your testosterone. It won't. Focus instead on the big levers: 7 to 8 hours of quality sleep, regular resistance exercise, a diet rich in whole foods and low in processed sugars, stress management, and maintaining a healthy body weight. If your labs confirm low testosterone and you're symptomatic, your doctor can discuss whether testosterone replacement therapy is appropriate for you, along with the risks and benefits. As for erectile dysfunction, the relationship with masturbation is more nuanced. If your ED is primarily vascular, caused by atherosclerosis, diabetes, high blood pressure, or smoking, then the issue is blood flow, and masturbation isn't going to fix that, though maintaining regular erections through assisted methods can help preserve tissue health. If your ED is primarily psychological, performance anxiety, stress, depression, then solo sex can actually be therapeutic because it removes the pressure and allows you to reconnect with your body's responses without an audience. And if your ED is multifactorial, which is common, then masturbation becomes one piece of a broader treatment plan that might include lifestyle changes, medications like DFIV inhibitors, vacuum devices, or even counseling. The key is not to use masturbation as a substitute for medical evaluation. If you're struggling with erections, get evaluated. Your doctor can assess for cardiovascular risk factors, check your testosterone and SAW, and develop a tailored plan. I want to offer you a practical 30-day protocol that you can experiment with, adjusting as needed based on your individual response. This isn't a rigid prescription, but rather a framework for developing a mindful, health-oriented approach to masturbation that integrates with your broader wellness goals. Start by choosing a gentle frequency, let's say 3 to 4 times per week to begin, spaced out rather than clustered. On those days, give yourself time and space, rather than rushing through the experience. Begin with 5 minutes of deep breathing, allowing yourself to relax and tune into your body. Use lubrication from the start, and experiment with varied technique, different grips, speeds, rhythms to broaden your responsiveness. As you approach orgasm, focus on the sensations in your pelvic floor, consciously relaxing between contractions after climax. Take a few minutes to hydrate, stretch gently, and notice how you feel physically and emotionally. Alongside this practice, integrate pelvic floor exercises, simple Kegels, where you contract the muscles you'd use to stop urination, hold for 5 seconds and relax for 5 seconds. Repeated 10 times, once or twice a day. Add some foods rich in nitrates, which support nitric oxide production and vascular health. Watermelon, including the rind, if you blend it into smoothies. Leafy greens like spinach and arugula, beets and lemon. These won't replace medication if you need it, but they support the underlying physiology. If you have kidney disease, heart failure, or are on nitrate medications for angina, consult your doctor before increasing dietary nitrates significantly. Schedule any overdue health screening SAW testing if you're due based on age and risk factors. A general physical, maybe a lipid panel and hemoglobin A1C to assess cardiovascular and metabolic health. Track your morning erections, not obsessively, but notice whether you're waking with erections most days, occasionally, or rarely. Morning erections are a sign of healthy vascular and neurological function, and changes in their frequency or quality can signal issues worth discussing with your doctor. Track your rigidity and comfort during masturbation. Are you achieving full erections easily, or is it taking longer and requiring more stimulation? Are you experiencing any pain, discomfort, or new symptoms? Use this information to adjust your approach. By week 2, you should have a sense of whether this frequency feels right or whether you need to dial it up or down. By week 4, you're looking for patterns: better sleep, improved mood, reduced stress, stable or improved erectile function. By week 8, You've established a rhythm that feels sustainable and aligned with your life. If at any point you're noticing worsening symptoms, more pain, more urinary issues, declining erectile function, pause and consult your doctor. This protocol is meant to be adaptive, not dogmatic. Let's talk about realistic timelines and expectations, because one of the biggest mistakes men make is expecting immediate, dramatic results from any single intervention. If you've been dealing with low libido or pelvic floor tension for months or years, it's going to take time to see improvement. In the first 2 weeks of a more mindful approach to masturbation, you might notice better sleep, reduced stress, and more awareness of your body's responses. By 4 weeks, if you're also working on diet, exercise, and sleep, you might notice improved morning erections, better rigidity, and more consistent arousal. By 8 weeks, patterns should be clear. You'll know what frequency works for you, what techniques feel best, and how this fits into your overall sexual health. If you're not seeing the progress you hoped for by 2 to 3 months, or if you're noticing new or worsening symptoms, that's your signal to escalate care. Schedule an appointment with a urologist or men's health specialist who can do a thorough evaluation, history, physical exam, labs, and imaging if needed, and develop a more targeted treatment plan. Masturbation is a tool, not a cure-all, and sometimes you need medical intervention to address underlying issues like significant vascular disease, hormonal deficiencies, or structural problems. Finally, I want to close with this: masturbation after 50 can absolutely be part of a healthy, vibrant sexual life when it's approached with mindfulness, moderation, and alignment with your values and your medical picture. It's not a substitute for intimacy with a partner if that's what you want. And it's not a replacement for proper medical care when you have symptoms that need evaluation, but it is a legitimate, normal, beneficial aspect of self-care that supports pelvic health, prostate function, mood, sleep, and sexual confidence. You don't need to feel guilty, ashamed, or secretive about it. You do need to pay attention to your body, adjust your approach based on feedback, and seek help when something doesn't feel right. I've spent a quarter century helping men navigate these issues, and what I've learned is that the men who thrive are the ones who approach their health with curiosity, honesty, and a willingness to adapt. So here's what I want you to do. In the comments below, tell me the one habit from this video that you're going to test this week. Maybe it's adjusting your frequency, maybe it's adding pelvic floor exercises, maybe it's scheduling that overdue saw screening, maybe it's experimenting with lubrication or varied technique. Share what resonates with you. And if this video was helpful, subscribe to this channel for weekly men's health guidance that cuts through the noise and gives you practical evidence-based tools. Share this with a friend over 50 who's navigating these questions but might not know where to turn for real answers. I read every comment, and I answer the top questions in upcoming videos. So let me know what else you want to hear about prostate health, treatment options, testosterone therapy, IDS eater management, sexual health after cancer treatment. I'm here for all of it. Thank you for trusting me with these conversations. Take care of yourselves, and I'll see you in the next video.